Today we're going to sum up for the past 3 months of basic structure of the body, which we started with the bone, the muscles, and then overall the function of the spine. So let's start with this new think outside of the box exercise. I would like you to connect all 9 dots with 4 continuous straight lines. This has to be a continuous line. Think about 4 lines that you need to connect all 9 dots. What do I want you to do this exercise? Well, the key is by thinking differently, this will give you a better way to understand why some of the things I'm going to show you needs some thinking outside the box. So first of all, let's try drawing the 4 lines. You probably tried it this way. Well, you're missing 1 dot. You got 4 lines connecting, but you're missing 1 dot. Let's try it the next way. You probably did this one too. You got 4 lines, but you're missing 2 dots. Try not think inside a box. I mean, the key is we see 9 dots and we think it's only probably a box style. Well, it's a little bit more than that. I really want you to think outside. The lines don't have to be exactly pivoting at the same dot. And so let's try this. This is the answer. You could actually go outside the dot because the goal is just to connect all 9 dots with 4 lines. So with this, I want you to start thinking and viewing things a little bit differently. Some of the things that we do during the day, our habitual daily postures, have been somewhat a habit by now. And with this habit, we often forget. We don't really think about redoing it, correcting it, or changing it in any way because we thought that's about normal. Let's go to sleeping, for instance. Sleeping. Often, people sleep on their side for comfort or because their partner's on the other side. They don't want to be facing each other, or they just have a habitual side of sleeping better when they sleep on their side. Now we sleep on their side. Make sure you have a higher pillow than usual because of the shoulder width and your neck. You want it to have a pillow that's a little bit high enough where it keeps your head in a straight line. Now you do want a big pillow as well. This pillow should support your leg high enough so that it's about the same level of your pelvis. Do think about when your leg drops down, it will draw weight and pull and weight on your pelvis. This could cause lower back soreness during the night, and also depending on if your bed is hard or soft, whether it keeps your hip in alignment or it actually sinks down and gives you that slight indentation comfort, but the pillow is important. Now, sleeping on your back is actually the best, better than sleeping on your side. When you sleep on your back, you do need a pillow. Once again, there is a gap between your skull and your shoulder because the cervical curve curves forward and you do need that pillow. A lot of times we try many pillows that may not be a good fit. Well, if you're Asian, most likely you'll have to look for a pillow that's slightly smaller. The contour pillow may be a little bit too high. They're made usually for someone who's about average of 5'5" to 6 feet. If you have lower back pain, you do want a pillow under your knee. Why? Because that gives you a relief of muscle tension. When we sleep flat, our lower back muscle is attached to the pelvis, which the legs muscle are attached to the pelvis as well. When you have leg tension, it'll pull onto the pelvis. As you lay on your back, that muscle tension is going to pull on the pelvis, which will reversely tug onto your lower back, and that creates muscle tension, straining, and soreness while you lay flat. Most people like to put a pillow underneath their leg or knee. I recommend at the knee level, not the leg level, because that still causes and creates some weight pulling onto your pelvis. Sleeping on sofa is definitely a big no-no, but we can avoid sometimes when you accidentally fall asleep. That just creates a bad habit. Sofa does not have support, and it has a high armrest where you could feel comfortable temporarily because that gives you a nice neck stretch after a day's usage. Oftentimes, I do recommend patients to stretch your neck laying on the sofa with that high armrest. It's a temporary neck stretching relief, but it's not recommended for you to actually sleep on a sofa. This is mainly because there's no lower back support. Having kids sleep on the sofa is also not good for the reasons that there's no back support. You may think it doesn't matter since kids are so flexible, but for the long term, we strongly recommend you don't allow kids to fall asleep on the sofa. It creates a bad habit for the future. Now, sleeping on your back without a pillow is also an issue. Why? Because there is a curve between your skull and your neck. And without a pillow over a night's rest, your cervical curve is actually being dropped and reversed. Most of the pillows in the United States are made for people that are about 5'5" and over. If you're 5'5" and under, I recommend you look for pillows that are specifically a little bit smaller, because the contour of the pillow may be a little bit too thick and too high that doesn't give you support. We strongly recommend pillows that have a cervical curve support, which gives you a better support than head and shoulder region. Now, sometimes people have pain in their mid-back and they would stuck a pillow so that they would feel much better during the night to fall asleep. If you have the feeling that you need to put a pillow underneath your mid-back or shoulder blade region, that probably means that you've been hunched over all day long. A pillow would help you open up your thoracic region. You'll feel good for temporary, but for long-term wise, it could cause and create neck kink. And if you toss and turn, it may give you a little bit of overstretch that could cause a morning kink neck. So tucking a pillow wherever your pain is most likely not advisable. We often recommend you stretch before you go to sleep to lessen all the tension that you have. Next, we often see people have a stack of 2-3 pillows before they go to sleep. And that is just as bad as all day hunched, slumped forward, looking down. And if you fall asleep in this, that's no different than the bad posture that you have sitting in front of a desk, except this time you're laying down, the gravity is forced down differently. That doesn't give you a nice support and relaxation for the interior muscles. It is best that you don't read or watch video before you go to sleep. Oftentimes, our brain's overstimulated, thus you can't sleep well through the night. Some people may have acid reflux that they have to sleep on high pillow to prevent themselves from acid reflux at night. In that case, we recommend a big wedge pillow instead of a pillow just behind the neck and head region, or buy a bed that has the elevation capability, so it's flinted for the entire upper body, not just the neck and shoulder region. If you have acid reflux issues, you might want to try not to eat 3 hours before going to sleep. This way, the contents in your stomach would have been passed down already. Sleeping on your back is a big no-no. Why do I say that? Because your head will be turned to one side for a long period of time. Can you imagine having to set an alarm for your head to turn to the other side after certain hours to make sure that you have even distribution pulling to the neck and shoulder region? Besides that, you might have a bigger stomach. Just kidding. There's no study that said sleeping on your stomach would cause a big stomach. But oftentimes, our body naturally wants to get into a position where it would feel comfortable. And you will find if you like to sleep on your stomach, it's probably because you're not stretching your chest muscle and your neck and shoulder muscle, where you would feel that stretching feels really good before falling to sleep. There are times I would recommend patients to stretch your neck and shoulder muscle, but resting over a table with your arms on the table and your head turned to one side. This gives a nice stretch to the SCM muscle, which is one of the big neck muscle. You can also imagine that being on your tummy, reading iPad, iPhone, or laptop is temporarily good to reverse your all-day sitting posture and looking down posture. But that's only a temporary solution to counter all-day sitting and leaning forward and looking down. Now let's talk about getting in and out of the bed. It's something that we don't think about. Why? It is so natural. We just got in, lay down, and got up and left the bed. Well, only when your lower back pain occurs would you think about how to get into bed and get out of bed. The best way to get in and out of bed is to actually lay on your side, let your body drop down with your hands supporting a weight and bending your knees as you lower yourself. Coming up is also recommended that you turn on your side first with your spine already perpendicular to the bed and push yourself up. This will ensure that there is support of your lower body with your upper body being straight instead of being turned and twisted with partial contraction of your back muscle. Oftentimes people don't think about getting in and out of the bed as a possible cause of issues. Imagine you had an alarm and you were late. You quickly got up with a swift turn of getting up without thinking. That could be a beginning cause of a micro tear. It could lead into a swollen fluid to a back pain, or a micro tear on the disc or facet joints or ligaments that could cause into issue a couple days or weeks down the line. So start changing your getting in and out of bed posture. It can be good if you're in your 40s or 50s. Once again, try to be aware of all your posture as a way to recheck yourself, as we often forget through time that it is natural, but natural may be just some bad habits. Next, we often pop our neck. And if you never pop your neck, I'm sure you probably pop your knuckle. And if you have not popped your knuckle, you might have heard yourself pop somewhere, sometimes in your lifetime. Often people wonder what the popping sound came from. The popping sound is most likely just a release of gas from a vacuum-sealed joint. It's almost like popping your knuckles, where in each joint, it has its own tight vacuum seal. And when you pop your neck, the sound came from your facets, which are the connecting joints of your cervical vertebra. And we often find an instant relief, but that doesn't last long. Often you'll find yourself wanting to pop yourself probably more than once a day. These are often caused by tight muscle to one side or multiple directions or both sides, where you felt like you need to do something to give a quick temporary relief. I often ask patients, if you pop your neck to one side, which it has 7 facet joints connecting on one side, and then you have 7 more connecting on the other side, it's a total of 14 on your cervical. How do you know which one you popped and which one you didn't pop? Unless you get a nice 2 and 2 or 3 and 3, but still, that still doesn't balance out. So oftentimes, we don't recommend you trying to pop yourself. When you feel like you want to pop your neck, instead of popping it quickly with a swift turn, why don't you start stretching your neck in all directions and find the tight muscles and stretch them out. This is often a better solution than a quick pop and release. Now this one we call Meany Whiplash. Oftentimes we don't think about falling asleep in a car or sitting in somebody else's car while they're driving. That could give you Meany Whiplash. Sometimes sitting in the airplane, we fall asleep. That also gives you Meany Whiplash. I have a patient who is smart, who always goes on the flight with a little cervical collar to give it a nice support in all directions. Or you could bring your air inflatable donut pillow or regular donut pillow to help you from bobbing your head left and right, and that could create discomfort at the end of the trip. So Planet Head is good for a better trip or vacation, because you could to help you from bobbing your head left and right. Now the neck is very delicate, but the head is quite heavy. Oftentimes, if you think about how we sit through our day in front of the computer or TV, or how we use our phone, it's all important that we actually start to pay attention to the position of the head. The head is 8 to 13 pounds, which lands and rests on the first cervical, which is only a couple ounces, and the rest of your cervical is much thinner, and the muscle is much smaller to hold the head in its position. If we are not aware how we use our daily posture, these could be a frequent cause of minor discomfort that leads into a major issue, such as degeneration and neck spasm. This next one, as you see with laptop sitting, now the general public are much more aware of their posture, but oftentimes you may think just a short 10-15 minutes or half an hour on the laptop with no support or laptop stands or extension keyboards is okay. Well, not really. Everything adds up, and so if you really have to be somewhere without the support of extension keyboard and laptop stand, I would strongly recommend scoot back of your chair where you can sit at an angle as you lean forward with your elbows rested on the table, typing with the laptop a little bit further away in the middle of the table. Then your head would actually extend and look up and forward. This could be a temporary solution if you don't have anything and you have to use your laptop. This will keep your back straight and your head up. In a way, it's almost like laying on your back, where you have to extend everything reversely instead of hunching. It's always better to be aware and modify your posture as needed. As we often do things at home or move things at home, we may be reaching and lifting, and often we stand with our knee locked. With this knee locked and reaching or turning and twisting, it often puts more pressure on the lumbar region. If you're more aware of that, all you have to do is bend your knees. If you bend your knees, your lower back can engage a little bit better. Your leg muscle will contract. It gives you more support for the upper body to do whatever that you need to do. This is just a quick mind awareness to your posture that could support and prevent lower back injuries in the future, or lower back muscle strain or wear and tear. Same thing as you're ironing, or if you're doing anything standing, as you have to lean forward, it's best that your legs are not locked straight. It's best that you actually step on a little stool or bend your knees forward to give you a better support of your lumbar. So this is no different than if you have to stand. If you're using a standing desk, it is best that you don't stand straight with your knee locked. It is best that you either have slightly bent knees, one forward with a slight warrior pose, or side shift to distribute your weight from leg to leg and using your core, abdominal muscle, and leg muscle all together instead of just using a lower back and upper back muscles. You may want to try to step on a box or a tiny stool, and you'll be surprised how much change of muscle contraction you can get from just shifting your leg weight. Now, vacuum is the same as you lean forward, or if you have to lean forward to pick up groceries or any object, it is best that you bend your knees at all times to distribute weight contraction in different parts of your lower body. By doing so, you're using the bigger muscle to support your daily activity, which is very important. Next, let's talk about why standing and slouching can increase your load of force on your lumbar. When you stand straight, your head and your shoulder lines up, where there's less pressure going straight down. But as you lean your head forward, your head weight contributes to your mid-back, and your entire head and upper back contributes to your lower back tension. When you slouch, everything presses down. That means your abdominal muscle is probably not contracted. Your lumbar disc and bone is bearing all the weight. If you could be more aware of how you contract your posture by lifting your head up, bring your shoulder back a little bit, and contract your abdominal muscle to help support your upper body weight, this will simply change everything on the upper body, including less tension in your neck and shoulder region. Now, if you could also bend your knees just ever so slightly, it also will help you shift your weight from your lower back to your leg muscles. Now, wearing high heel also increases loads on your lumbar. Why is that? Because as you elevate, you would need to arch back a little bit. That creates more contraction of lumbar muscle. And your head tends to lean forward, where you have to lift by using your lumbar muscle a little bit more to arch your back. So if you have to wear high heel, I recommend that you could slightly bend your knees, contract your ab a little bit, and that'll also help you take off some loads of pressure on your lumbar. Same thing as if you have a big stomach. We call it the old spare tire. It also causes and creates the tendency to lean backwards as if you're wearing a high heel, and does that increase the load on your lumbar. The best way also, once again, you could try to bend your knees a little bit. Once you bend your knees, the contraction of the hamstring, the quads muscle, will shift your pelvic, which will cause you to contract your muscle differently. This in turn could lessen the load on your lumbar discs. Oftentimes we find patients that have a bigger stomach can wear a lumbar brace to help them throughout daily activities if their back muscle is weak. But that is temporary until they can build up their back muscle. Of course, when you're pregnant, it also increased the load on your lumbar. But the good thing is this is a temporary 9-month carriage and not permanent. Whereas if you have a big stomach, that's a permanent carriage. During pregnancy, we often ask pregnant women to stretch a little bit more on their legs and their lumbar muscles to help making the pregnancy period more comfortable. And we also ask them to slightly bend their knees and not to lock their knees as they stand or walk to help release lumbar tension as well. Next, let's go into proper ways of getting in and out of the car. First, sit and then turn and rotate your knee into the car and then shift your upper body posture to drive. Same thing as when you're coming out of the car, because cars are often lower in general. Nowadays, there are more people driving SUVs and higher cars, then there's less issues of back sprain getting in and out of a car. But if you still have a lower car, the best way is to sit on the seat of the car first and then turn and then lift both of your legs into the car and then shift your upper body instead of having one leg in as you sit and with a turn and twist the body getting into your car and getting out of your car. That often can have minor strains in certain parts of your back, and all you need is that one time if you're tired, stressed, or unaware of your quick in and out rushing hour, that strained muscle could happen, and through a couple of days of inflammation it turned into you have no clue. So this sums up today's lecture, and the key is try to think outside the box of everything that you do from now. There's a lot of things that we don't think about that we should really think about. How you carry your posture, how you move, how you lean over to pick up a piece of paper on the floor, how you shift your body while you're turning and twisting or just talking to someone. As you walk, as you sit, as you watch TV, all these things, I want you to start thinking outside the box of how you can make it better by balancing yourself, by using both sides of your body and by being aware of your head and shoulder position. That in turn will give you a better balance of your entire muscle usage. Once again, daily stretching is most important. Constant good posture is the key to prevention of future degeneration. Gravity plus weight equals degeneration. May you continue to improve for a better lifestyle. Thank you.